So now going on to some of the things that we've been hearing in the news and how that may impact your insurance coverage. So this slide here, it seems very political, but healthcare, unfortunately, in this country right now is very political. And this is the reality that we're facing. I think many of you are hearing about, what's going to happen if the ACA is repealed? How is that going to impact whether or not I have insurance? You've likely heard stuff about, work requirements. Is that going to affect me? And so we'll hopefully help address some of those answers for you. I don't know that I have all the answers, but just wanted to touch on some of sort of the big headlines that we've been hearing. One of the other important things that the ACA did was expand Medicaid. So this is where we are now. So the light blue states are all the states that have expanded Medicaid. And so most recently, Virginia was one of the ones that was added. And I think we're at 32 states now that have expanded Medicaid. And some other states like Idaho, Nebraska, and Utah are actually considering expanding it through a ballot initiative. So come their election day next week or in 2 weeks, the residents of those states will, or the voters in those states will be deciding whether or not they want to expand Medicaid. Other times they are, it's something that goes through the legislative process. So Medicaid expansion is a provision part of the Affordable Care Act. So for those listening on the webinar, the question was, what does expanded Medicaid mean? So the Affordable Care Act set forth a provision there that says states can or have the ability to expand their Medicaid program. So that's really the eligibility for those who could be covered by Medicaid. So now I believe it's up to 133% of federal poverty level, 138% of federal poverty level that people can be or can have access to Medicaid. But that's really dependent on the states. So not all states have expanded. So you can see the dark blue ones are the ones that haven't yet. And really, I guess to show it in news form, when Virginia voted to expand Medicaid earlier this year, it expanded healthcare coverage to 400,000 Virginians who otherwise wouldn't have access to those services. The one thing that I want to call attention to as well is this notion of work requirements. So Virginia passed Medicaid or passed Medicaid expansion, but there is a bit of a how do I put it? A caveat with that. They would only the state has included a waiver so that those people, or that would encourage people to work in order to receive Medicaid. So that's the bit of the difference there. And so that's something that was made possible through regulation earlier this year. The Center for Medicare and Medicaid Services issued that states have the opportunity to submit a waiver to the federal government, and that the federal government will consider it if it includes these work requirements. And really what that means is that people who the government is referring to as able-bodied to work in order to receive these benefits. And they would also have to demonstrate through reporting that they are abiding by whatever these work requirements are set forth for each of these states. I'm gonna kind of speed up here because I know I'm a little short on time now, but one of the things I really wanted to bring to your attention as well, and what you may also have been hearing in the news, is this notion of short-term health plans. And there is a handout that you all should have received about it. So short-term health plans are plans that are designed for temporary coverage, but it can be purchased in the individual market as well as the marketplace. And they're also known as limited duration plans. And they're very attractive to a lot of people because, again, it's a lower monthly premium. But the thing is, and what we want to call your attention to is, if you look at it a little closer, read between the lines, all of the protections that I described to you earlier won't be, they're not included if you purchase a short-term health plan. So short-term health plans are not required to cover people with pre-existing conditions. They don't provide, or they do not cover preventive or annual health services, and they're not comprehensive. So one of the questions was, is my child going to have access to a comprehensive health plan? Do they get a short-term health plan? No, they're not. And usually what you end up finding is that, even though they have a lower monthly premium, they may end up having to pay more in copays. And sort of the same thing with like network status. It's, it will be a limited or narrower network as well. And so another thing that I'm sure you all have been hearing a lot about is, changes to pre-existing conditions, what's going to happen there with some of the proposed policy changes that you're hearing about. What we've been hearing in the news lately is, with the elections coming up, if Congress retains the Republican lead, then we very well may see another action again to repeal the Affordable Care Act. If that doesn't happen, then that's not the only thing we need to worry about, because there's still some regulations that we see that are weakening these protections. I think those work requirements is one example of a regulatory action that took place to sort of weaken some of the protections that were set forth in the ACA. And we're also seeing this play out in the courts. A group of attorney generals from different states have come together to say that the ACA is unconstitutional. As of the beginning of this year, the tax law that passed late last year dismantled the individual mandate, which was the portion of the law that required people to have health insurance. And if they didn't, they would have to pay a tax. That was taken out. And so now the constitutionality of the law itself is being challenged. And so we don't know what's going to happen yet. And I know many of you have questions as far as, what does this mean for you? And I think, I guess the short answer is, I don't know, unfortunately. None of us knows. That's probably the biggest $1 million question right now, is what does this mean for my healthcare? How's this going to, play a part in the access that I get? But I just say that what you can do in the meantime is to just make sure that you continue to communicate with your doctor, your healthcare team, and your families about what matters to you. I think you all are doing you guys are already educating yourselves by coming here to learn more about health insurance, possible barriers that are there, and what resources are there to help you. And I would also say to advocate, because once your voice joins with others, it really raises attention to an issue.